Welcome to the PharmaVOICE 100 one-on-one video series with Taryn Groen.
Eric, congratulations on being named to the 2020 PharmaVOICE 100.
Thank you very much, Taryn. It's an exciting time to be part of this celebration.
Well, it's a well-deserved honor, and thank you as well for joining us for our 24-hour celebration marathon.
Absolutely. I appreciate the invitation. Thanks for having me.
Oh, it's our pleasure. Eric, I know you are dedicated to the rare disease space. Please tell us why this area of focus is so important to you.
Sure. Well, for me and for so many others that are in rare disease, it's personal. I am a rare cancer survivor 2 times over, and I'm not unique amongst those in the industry and in Retrophin. For so many of my colleagues, they are rare disease patients or survivors or caregivers themselves. And I think that gives us a personal experience and perspective that we bring to our work. We're passionate about what we do, and we realize that for rare disease patients and their families, it's a journey. And it's a journey that oftentimes is far too long and far too uncertain. And one that is absolutely critical that we focus on not just bringing new therapies, but addressing some of the barriers that these patients and families face, like getting an accurate diagnosis or having access to clinical trials.
It is such a journey, and it's such important work that you all are doing, so thank you for that. You're also doing such important work in the area of equity, diversity, and inclusion. I know you're equally passionate about this topic as well. Talk to me about why it's so important to the industry to address this issue, and what steps Retrophin is taking to move the needle.
I think it's a critical time, and it's something that I've been passionate about for my entire career. I've seen how important it is both in the professional capacity, but also in the mission that we as an industry and as a company have. As a gay man, there were so many times early in my career where I didn't feel like I belonged, and I didn't see others that were like me. And so I want to make sure that as an employer, first and foremost, that everyone feels like they can come to work and be their best and true selves, and to see that this is an industry for them. And for the mission that we do, sadly, we see that not just does rare disease not discriminate, it can affect and does affect everyone. But once a patient is affected by rare disease, if they're a person of color, sadly what we're seeing is that the time to an accurate diagnosis is much longer. The ability to access clinical trials is much lower. And the ability to access and afford effective therapies is less. And we believe that we can change these inequities, and that's the role that we want to play. So one of the most exciting things that we're doing is in partnering with Black Women's Health Imperative. And earlier this year, we have helped to create the Rare Disease Diversity Coalition, which is comprised of about 40 incredible leaders, both in rare disease, such as NORD and Global Genes, as well as healthcare leaders within communities of color, all focused on addressing some of these challenges, whether it's in the policy platform or in the time to diagnosis, or perhaps in accessing clinical trials. So we believe that we have an important role to play that sadly has been lacking, not just within rare disease, but broadly within the healthcare arena.
Well, I can't thank you enough for joining us, and thank you so much for all the great work you're doing, and I wish you continued tremendous success.
Thank you so much for the opportunity. I'm glad to be part of this celebration, and now I'm going to get back to the great work that we do. Thanks so much, Taryn.
Thank you.
For more PharmaVOICE 100 content, visit www.pharmavoice100.com.